Hello, ladies and gentlemen, and welcome to another video at the Pharmacist Academy. Woo! So it's almost the time for mid-year and residency applications and interviews. So I decided to take a break from my infectious diseases video series and bring you some videos to prepare you for the residency process. Now, for those of you who don't know, I completed a PGY1 residency and a PGY2 residency in oncology. I've reviewed the applications of PGY1 candidates and PGY2 candidates, so I have some good experience and I know what I'm talking about. In this video, I'll give you tips on writing a letter of intent. So let's jump right in. What is a letter of intent? A letter of intent is an introductory letter to an employer. So in this case, it's going to be the residency program you're interested in working for. It includes a general overview of your industry-specific skills and experience, as well as the reasons why you're interested in working with an employer. So it's pretty straightforward, right? You're going to be writing to this residency program, basically telling them you're interested in becoming a resident, and then you're going to include your qualifications, your specific skills, and experience that you know will help you succeed in this residency program. Now, here are some general information about a letter of intent. In my opinion, it's arguably the most important aspect of your application. And the reason why I'm saying this is because I refer to it as the pre-interview. In your letter of intent, you're going to be including certain things that could have been asked, right, during your interview. So it's like you're basically answering interview questions ahead of time. So with that, you have more time to, put it in the best way possible, right? Include the best answer. Ask people to review it, right? So you get to kind of like polish it up. So this is why I really feel like a letter of intent is extremely important. It helps you distinguish yourself from other candidates. So if you have two good candidates, a letter of intent could definitely help make a difference. Best fit for program versus best qualified for a program. Sometimes the perfect candidate may be the best qualified for the program, but they are not the best fit for the program. In the letter of intent, this is the first time the program directors will be able to distinguish this. So they may look at it and they could help them determine if you will be best fit for the program or you're just well qualified for the program, which is a huge difference. A well-written letter of intent can help an average candidate get an interview, which is extremely true. It's very important. Once again, if your letter of intent is really, really good, even though you didn't get such high grades in school, even though you didn't really participate in extracurriculum activity, if you have a very good letter of intent, then you have a better chance of getting an interview, no doubt about that. So you definitely don't want to count yourself out if you feel like you don't have the best grades. With a letter of intent, you always have a chance. A poorly written letter of intent may prevent a good candidate from getting an interview. Introduction of a letter of intent. This is a general format that you could use if you would like. So you want to begin with, I'm writing this letter to express my interest for a PGY1 residency program at dot dot dot. All right, you just put the hospital name there, followed by how did you learn about the program? All right, so if you spoke with past residents, preceptors, or directors, or if you completed rotations at that institution, this is the perfect time to include that there, right? This is how I heard about the program. And then you can end it with just a general statement on why you chose that site. I believe this site provides the rotations, learning experiences, and environment needed to accomplish my goals. So something very general, you don't need to get specific because that's what you're going to do in the body of the letter of intent. Now in the body of the letter of intent, I recommend that you do 3 paragraphs. So each paragraph, you're basically going to be answering 2 questions. So for the first one, why did you decide to do a residency? Why do you want to do your residency at this specific institution? Then for the next paragraph, you're going to do what are your goals during residency? What skills and experiences will help you succeed during the residency? And for the last paragraph, What are your future plans after residency? How will this residency help you with your future plans? Right? How will it help you accomplish it basically? Why did you decide to do a residency? Tell them exactly why. You don't need to beat around the bushes. You don't need to go and search for the perfect answer that will increase your chances of being accepted for the program. Think about why you want to do a residency and tell them. For me, I basically wanted to improve my presentation skills. That's not the only reason why I wanted to do a residency, but that's one of them. I noticed that on rotations as a student, residents used to do a lot of presentations. So I wanted to be in that position so I could also improve my presentation skills. So that's exactly what I said. Your answer is the best answer. So don't try to go find somebody else's answer and use it just because their answer just seems so appealing, right? It sounds so good that any program director will take them. Include your weaknesses and how a residency can help turn them into strengths. So for me, when I was telling them why I wanted to do a residency, I pointed out that I'm not like good at doing presentations, right? So I was going to use the residency to help improve this. Pretty simple, right? So whatever you put as the reason why you wanted to do a residency, make it seem like a weakness, and then you kind of flip the script and say that a residency will help turn them into strengths. Tell them you love feedback, criticism, and a residency will refine your clinical skills by providing this. Okay, feedback and criticism is something you're going to get a lot during your residency. So let them know that you're ready for that, right? You're ready to accept these things and actually reflect on them and improve. All right, so this will really, really help you stand out. Tell them you want to be challenged and pushed to the limit. This is what happens during a residency. Okay, they're trying to push you to the limit. They want you to use your full potential. Okay, so once you include this in your letter of intent, it's going to stand out automatically. It's going to show them that you're ready for this. Why do you want to do your residency at this specific institution? This, in my opinion, is the most important question that you have to answer during your letter of intent. Do your research on the site. Do your research on the site. Do your research on the site. Okay, so how do I put this? I mean, Google the site. If you know anybody that works there, if you know any past residents, ask them questions about the site. All right, have they won any awards? What is the patient population they serve? Any specific specialties they focus on? Faculty, pharmacy environment. Okay, so just gather information about the site and find a way to incorporate it into your letter of intent. Just to show that you did your research, because it's very important. If you did your research, it shows that you probably really want to be at that site, right? You're probably really interested in that site. That's why you did an extensive research on it. So find something and include it, okay? Because this question is very important. Acknowledge the accomplishments and how you would like to be a part of it. So if you want to go to an institution, right, that's known as, like, let's say the number one healthcare center for managing heart failure patients, something like that, right? You want to acknowledge that in your letter of intent, and then you want to say something about how you want to be a part of it. Even if you don't want to be a part of it, just include it. Link what they offer to what you're looking for. All right, pretty straightforward. Why did you want to do your residency at this specific institution? Okay, because you guys have a great pharmacy environment, right? Everybody here is like a family. You have a diverse group of rotations. And speaking with past residents, a lot of them have actually ended up getting great careers after their residency, something like that. Okay, so just link that together. How did the past residents turn out? All right, so that's exactly what I just mentioned. What are your goals during residency? What would you like to accomplish during residency? Right, this is once again very personalized. There's no specific answer to this, right? There's no one perfect answer. Okay, your answer is the best answer. Your goals as a resident should align with why you're doing your residency. Don't just think about yourself. Always think about the institution also, okay? You want to also help the institution accomplish this. You want to help them improve in this. Don't just think about what you want to accomplish, but also include how you want to help the institution accomplish something. That's very important, actually. Please take note of that. Focus on what you could do for them, like I just mentioned, the community, the pharmacy profession in general. Oh my goodness. If you include this, you are the GOAT, okay? You are the greatest of all time. Seriously, if you include that your goals, like one of your goals, is not only to help them accomplish something, but to also like help the community around that hospital or even the pharmacy profession as a whole, that's pretty huge, right? I mean, just think about that. Help advance and improve something that they have already started or they're known for. What skills do you have that will help you succeed during the residency? Very, very important, okay? And a lot of program directors look for this simply because they know that a residency is a long journey. There's a lot of ups, there's a lot of downs. So they're really looking for somebody who can like maintain, right? Somebody who can like keep it together throughout the whole thing. Somebody who's not going to break. Somebody who's a team player. Somebody who's willing to learn and get better throughout. Before answering this question, you must first acknowledge the possible challenges or obstacles that you expect during a residency. So, for example, a residency is a long journey that is meant to push a resident to function at their fullest capacity. As a resident, there are times that you will be criticized, have a lot of tasks to complete, become overwhelmed, or a little stressed out. So, you see what I did there with that example? I basically pointed out the challenges that people experience during residencies, okay? And this is all true. And program directors know this is true, okay? Now, list the skill sets that you have that will help you get through these challenges. So, for example, through the years in pharmacy school, I've acquired the dedication, the perseverance, and ability to accept feedback, which will get me through the ups and downs of residency. So, something like that, but just understand the whole concept of this specific part. List the challenges and then include the skill sets that you have that will help you overcome all of this. What are your future plans after residency? Once again, this is very personalized, right? There's no specific answer, but there are certain things that you should think about. And if you include these things, it's just going to make you look better, right? So, what career do you have, right, after your residency, right? What do you want to do? What are you doing for the institution you're working in? Once again, don't just think about yourself. What are you doing to advance the profession, right? After you finish your residencies and like, your future plans. You should think about all of these, okay? Because it's just going to be a better answer overall compared to somebody who simply says, okay, in the future, I want to be like I see myself as a infectious disease clinical pharmacist and that's it, compared to somebody who answers that part but also say, okay, but I'm also working to improve the antibiotic stewardship in the hospital by doing this and that. I'm attending media and giving presentations to advance the profession. Even if you know deep inside that you probably won't do all of these in the future, just think about the possibility, right? Include it because you never know it's possible. So if you include that, it definitely just sounds better than just simply answering what you want to do in terms of career in the future. How would this residency help you with your future plans and achieve your goals? So you could point out different things, right? And the number one thing is going to be based on the training and knowledge that the residency will provide you, the networking opportunities, the mental strength and skill sets you would develop. Okay, very, very important because this is something you would definitely develop during a residency. The resources that the institution provides, outreach programs, right? So if your goal, right, your future plan was to be somebody who's like well involved in your community, if the site you're going does a lot of outreach programs, then yes, that's one way that they will help you achieve your goals, right? Presentations, administrative role. These are all things that you will gain the experience of doing during your residency, and it will definitely help you achieve your future goals. Now, for the conclusion, this is just an example. You don't necessarily have to use this, but for the conclusion, please just relax, okay? The hard work has been taken care of. So for the conclusion, you could put something simply as, overall, I believe that I possess the mind and skill set that will help me fit in with your residency program. This residency will bring me closer to achieving my goals of becoming a well-rounded clinical pharmacist. If given the opportunity, I will contribute my skills, knowledge, and creativity in making the blank hospital an even more outstanding healthcare facility. Once again, right, you didn't think about just yourself, right? So even in the conclusion, you kind of mentioned how, you also want to help the hospital get better. Okay, that's huge. Please don't hesitate to contact me about any questions, and I look forward to the opportunity to visit your institution. Thank you for the consideration. Done. Now, here are some overall tips about a letter of intent. Each institution you apply to must get a specific letter of intent. And a lot of people actually don't pay attention to this, but this is so important. And this can automatically reduce your chances of getting a residency. If you write a letter of intent and you don't even include the institution's name in that letter, that's called a general letter, and that's not okay. For every residency program that you apply to, you must have a specific letter of intent addressing that program. So it could be the same letter of intent, but you may have to change certain parts, right? First, maybe you should include the institution's name, right? That sounds like a good idea. You should change the part where you're explaining why you want to do a residency at that institution, because that's going to vary for each institution. If you do that, that's at least better than just writing a general letter of intent and sending it to a ton of institutions. It doesn't work like that, okay? Have someone review your letter. Very, very important. Do not include summary of your rotations. I mean, I don't think I've seen this before, but please do not include that. These things should be on your CV. There's no reason for you to include this in your letter of intent. Do not include hobbies or outside interests. Do your research on the institution. So important. Oh my goodness. Spell check. It should not be longer than 2 pages. I recommend 1 page, and do not bold anything in the letter. And that will be the end of this video. Hopefully I was able to provide everybody with some good tips about a letter of intent, the formatting, and certain things that you need to include that you may have not thought about. If this video was helpful, make sure to like, comment, subscribe, and share it, okay? Share it with your classmates. Share it with anybody that's going to be applying for a residency. Post it on your school Facebook pages, Instagram pages. I want everybody to see it simply because I know I covered some very important things. As I mentioned before, I've reviewed several residency applications. I've looked at several letter of intents, so I know what I'm talking about. And I know there's a lot of things in this video that I mentioned that a lot of people are either doing or not doing. Make sure to connect with me on these social media platforms. Thank you for watching this video, and take care.